Hey guys, this is FixerMed. Welcome back to my high-yield hematology and oncology review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering the entire system of hematology and oncology in a comprehensive but high-yield manner. This will be part 22 of my multi-part video series of doing so. Today we will be taking a look at causes of macrocytosis. Without any further delay, let's go ahead and get started on today's content. Today I'd like to open up the presentation by covering an overview of macrocytosis. Normal red blood cell mean corpuscular volume MCV is 80 to 100 femtoliters. Macrocytosis refers to large red blood cells with mean corpuscular volume greater than 100 femtoliters. Several causes include vitamin deficiencies, alcohol use, and rare genetic conditions. Alright, moving on. Alright, next topic, vitamin deficiencies and macrocytosis. B9, folate, and B12 cobalamin deficiencies. Both deficiencies impair DNA synthesis, leading to larger, less mature red blood cells. This results in high mean corpuscular volume, termed megaloblastic anemia. Paired DNA synthesis also causes hypersegmented neutrophils with increased nuclear lobes. Alright, moving on. Alright, next topic, other causes of macrocytosis. Alcohol, a significant cause of high mean corpuscular volume even with normal B9 and B12 levels. Can also lead to other types of anemia such as sideroblastic anemia, orotic aciduria, a rare condition causing impaired DNA synthesis and increased mean corpuscular volume, caused by enzyme deficiencies. Leflunomide, a drug for rheumatoid arthritis, inhibits an enzyme related to this condition but is rarely relevant. Alright, moving on.
Alright guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far.
A 55-year-old man presents to his primary care physician with fatigue and pallor. Laboratory tests reveal a mean corpuscular volume MCV of 105 femtoliters. He reports a history of chronic alcohol use but denies any changes in his diet. Physical examination is unremarkable and there are no signs of neurological deficits. Which of the following is the most likely cause of his macrocytosis?
Alright, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now.
The correct answer is C. Chronic alcohol use. Chronic alcohol use is a significant cause of macrocytosis, mean corpuscular volume greater than 100 femtoliters, even in the absence of vitamin B9 folate and B12 cobalamin deficiencies. Alcohol can interfere with red blood cell production and maturation, leading to larger than normal red blood cells. The patient's history of chronic alcohol use and absence of other symptoms suggest alcohol-related macrocytosis.
Alright, let's go ahead and see why the other answer choices are incorrect.
The incorrect choices can be explained as follows. A. Iron deficiency anemia typically presents with microcytic anemia, mean corpuscular volume less than 80 femtoliters, not macrocytosis. B12 cobalamin deficiency can cause macrocytosis and is associated with neurological deficits which are not present in this patient. Additionally, dietary changes or poor diet are often involved. E-thalassemia usually results in microcytic anemia rather than macrocytosis. E. Hemolytic anemia does not typically cause macrocytosis. It is characterized by increased reticulocyte count and signs of red blood cell destruction, which are not indicated in this patient.
Alright, now that we have covered this question, let's move on to look at the next question.
A 45-year-old woman presents to the clinic with fatigue, weakness, and occasional shortness of breath. She reports a vegetarian diet for the past 5 years. Physical examination reveals pallor and mild jaundice. Laboratory tests show a mean corpuscular volume (MCV) of 110 femtoliters, elevated lactate dehydrogenase (LDH), and increased unconjugated bilirubin. Peripheral blood smear shows hypersegmented neutrophils. Which of the following is the most likely cause of her condition?
All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now.
The correct answer is D, B12 deficiency. B12 cobalamin deficiency leads to impaired DNA synthesis, resulting in production of large immature red blood cells, megaloblastic anemia, and hypersegmented neutrophils. The patient's vegetarian diet increases the risk of B12 deficiency as B12 is primarily found in animal products. The elevated mean corpuscular volume, hypersegmented neutrophils, and signs of hemolysis, elevated LDH, and unconjugated bilirubin are characteristic of B12 deficiency.
All right, let's go ahead and see why the other answer choices are incorrect.
The incorrect choices can be explained as follows. A. Iron deficiency anemia typically presents with microcytic anemia, mean corpuscular volume less than 80 femtoliters, not macrocytosis, and would not show hypersegmented neutrophils. B. Chronic alcohol use can cause macrocytosis, but it does not typically result in hypersegmented neutrophils or the severe hemolytic picture seen here. Thalassemia usually results in microcytic anemia and is associated with target cells on the peripheral blood smear, not hypersegmented neutrophils. Hemolytic anemia can cause elevated lactate dehydrogenase (LDH) and unconjugated bilirubin, but it is not associated with macrocytosis or hypersegmented neutrophils. Instead, it usually presents with reticulocytosis.
All right, now that we have covered this question, let's move on to look at the next question.
A 67-year-old man is brought to the emergency department after being found unconscious at home on a hot summer day. His temperature is 106 degrees Fahrenheit, 41.1 degrees Celsius. Laboratory tests reveal a mean corpuscular volume (MCV) 102 femtoliters, normal vitamin B12, cobalamin, and B9 folate levels, and elevated liver enzymes. A peripheral blood smear shows the presence of spur cells, acanthocytes. Which of the following is the most likely cause of his condition?
All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now.
The correct answer is D, heat stroke. Heat stroke, which can cause end organ damage due to hyperthermia, is associated with elevated liver enzymes and the presence of spur cells, acanthocytes. The high mean corpuscular volume (MCV) and the clinical scenario of hyperthermia and unconsciousness on a hot day strongly suggest heat stroke as the cause of macrocytosis and liver dysfunction.
All right, let's go ahead and see why the other answer choices are incorrect.
The incorrect choices can be explained as follows. PT. to 12 cobalamin deficiency is typically associated with megaloblastic anemia and hypersegmented neutrophils, not spur cells acanthocytes. B. Iron deficiency anemia usually presents with microcytic anemia, mean corpuscular volume less than 80 femtoliters, not macrocytosis. Chronic alcohol use can cause macrocytosis and liver damage, but the acute presentation with hyperthermia is more indicative of heat stroke. Orotic aciduria is a rare cause of macrocytosis due to impaired DNA synthesis, but it is extremely uncommon and does not typically present with the acute symptoms seen in heat stroke.
All right, guys, that is all I have for today. Be sure to leave a like if you found this video useful, a dislike if you did not find this video useful, and consider subscribing for more content like this in the future. If you would like to check out more review material, be sure to check out my other USMLE/NBME playlists on the channel. If you have any questions, comments, concerns, or suggestions you would like to make, please be sure to write them up and submit them in the comment section below. This is FixerMed signing off. Be sure to have a great day or great night, and as always, good luck studying.